I'm going to look at a simple blood test and it'll just let us know an indicator.
With this quick and inexpensive blood test, midwives at Doncaster Royal Infirmary can spot the early signs of pre-eclampsia. The potentially fatal disease affects 1 in 20 pregnant women. Symptoms include headaches and high blood pressure, but placental growth factor testing, known as PLGF, can help rule it out.
We've got a lot of women that like to self-diagnose on the internet. Obviously anxiety will give them high blood pressure, so we just bring them in and we do a BP series. We do the test if the series is reporting that we need to. Check the urine as well for proteinuria and check the function of the placenta by putting them on the monitor.
How useful is it for reducing anxiety in patients?
It's definitely reassured a lot more women in Doncaster.
In 2015, Caroline McFadgen and her unborn son Luke nearly died when she developed pre-eclampsia. With no test available, doctors hadn't realised she was critically ill.
When I got into the ambulance, he'd actually said that this is the highest blood pressure he'd ever seen. Even in heart or stroke victims, it was 244/128 or therearound. And at that point, it was an emergency situation. So I was whisked off to be administered magnesium and straight to the hospital to have a cesarean section at that point.
Tens of thousands of women have already benefited from this test, but so far only on a limited basis. Now the test is being rolled out across all of England.
But campaigners can't understand why the same isn't happening in Scotland, Wales and Northern Ireland.
We know the test works, we know it's good, we know that women want it, and we know that women want that certainty. We also know that it saves money for the NHS, £7 million a year if properly rolled out.
They say the test is a small price to pay for what could be a life-saving diagnosis. Martha Fairley, ITV News, Doncaster.